The Acute Neurological Rehabilitation Centre at the Wellington Hospital is the UK's largest inpatient unit specifically designed for neurological rehabilitation. Since we launched over 2 decades ago, we've established an international reputation for delivering the very best individually tailored rehabilitation programmes, with input from highly trained therapists and nursing specialists. The patients we're able to treat here include primarily stroke, traumatic brain injury, spinal injury, and we're also able to treat patients with prolonged disorders of consciousness or PDOC. We also treat patients with encephalitis, patients who have tracheostomies who may need a period of care on ITU. And we have the advantage here of being able to support this with strong neuropsychology input, because patients may well need that support to manage not just mood but also behavioural aspects as their recovery progresses. Any kind of acquired brain injury is a life-changing event, and of course no one considers that this is going to happen to them until it does happen. And that's where we come in, because we can dissect those problems very carefully. We can work out what are the impairments, how do they interact, and what can we do to help them. Our job is to help them to re-find that independence and also to re-find their sense of identity after the brain injury. It's actually amazing work to completely change somebody's life and get them back on their feet. And the sense of satisfaction that you get having worked closely with a patient, with a team, and then bring them out to the other end, back into the world as a sort of independent and more confident and more fulfilled person is hard to overstate. So when you do it carefully and well and you see a big change, it's extremely gratifying.